Relationship building and integration. And this is mini module 2 for artist managers. Welcome. This module is intended for you, the managers of Antiretroviral Treatment and Access to Services Program, ARTAS. This is the second of 4 self-paced mini modules and focuses relationship building and integrating artists into your agency programs. It lasts for approximately 30 minutes, and we want to remind you that this event does not replace a formal artist training. If you would like to participate in a formal training, we will provide you with the links at the end of this session for you to request it and to access the pre-course modules. We also want to highlight that this presentation is the result of a collaborative effort of 4 capacity building assistance providers, members of the CEBA Provider Network. And we are B.A. Laris from ETR Associates, Armand Lorth with JSI Research and Training Institute, Melanie Graham from New York City Department of Health and Mental Hygiene, and myself, Sarah Jane Rath from Proceed.
Text 3-stage support process.
As you know, by this point in the process, we have designed this series to support you, both supervisors and managers, who oversee programs that are implementing the public health strategy of ARTAS as part of your CDC-funded initiatives for high-impact HIV prevention. This is a 3-part series that includes, first, a live webinar in which you and other ARTAS managers participated that provided an overview of all of the key information you need to know to support your ARTAS staff. Second, a series of 4 self-paced modules to provide more detailed information on key components necessary to support the successful implementation of ARTAS, this module being one of them. And third, a live technical assistance session where you have access to a panel of skilled capacity building providers to answer questions and help troubleshoot any issues or concerns. During this presentation, we want to encourage you to take notes as well as to type the questions you might have on the pod that appears on the right-hand side of the screen. These will be recorded and we will address them during the live technical assistance session scheduled for March 28, 2018. So what is my role? As a manager, you are probably wondering what your role is with ARTAS. We like to think of this in a few stages that involve the getting started stage, the information you need to consider when becoming familiar with ARTAS and deciding when to implement the strategy. The pre-implementation stage refers to your agency making any necessary changes, planning for the necessary human and monetary resources, building relationships with community partners, creating a marketing plan, and developing a monitoring and evaluation plan. The actual implementation stage, which involves issues that your agency staff will focus on while implementing ARTAS, and the maintenance stage. That is, integrating ARTAS into your existing services, continuously working to adapt, monitor, and evaluate the strategy, as well as to make any necessary changes. This is laid out in great detail in the ARTAS Implementation Manual. We recommend for you to become familiar with it. It will be available for you to download at the end of this module. So pre-implementation, as we mentioned, there are lots of details in the ARTAS Implementation Guide, but today we're going to highlight a few key ideas that we think are the most helpful for you and other managers in the pre-implementation phase of ARTAS. And the objectives are as follows, up above on the slide. And today we'll cover the relationship building and integration for ARTAS. And after you complete this module, you will be able to describe interagency partnerships, identify collaborations outside of the agency, and review ways to integrate ARTAS into EBIs, effective behavioral interventions, public health strategies, and biomedical interventions. So let's begin. So what does ARTAS do for our agency? So you as managers may be asked why you're doing ARTAS. And here are some key messages you can share with internal and external stakeholders.
And since you will be sharing some of these messages with others, now we would like to share with you some ideas and pointers beyond promoting ARTAS. as to how you can maximize both external and intra-agency collaborations for referrals and linkage to care for clients who are eligible for ARTAS.
External collaborations.
You might remember the stakeholder buy-in worksheet discussed in Module 1. It is also available in the implementation manual, and it is a great tool for conducting an environmental scan. An environmental scan can help your agency assess the competitors in the industry and also potential collaborators. Staff needs to set aside a period of time to brainstorm agencies that might be great collaborators and provide referrals for ARTAS, and in turn, look at what your agency can provide to them. Community partners include medical care providers, social services agencies, homeless shelters, criminal justice programs, substance abuse treatment agencies, courts, faith-based organizations, and any other agencies and any other treatment resources where your clients may be linked to. And a key partner for ARTAS is this health department. Make sure that the health department knows about the ARTAS services and informs any of the grantees that your agency will be providing ARTAS to people who test positive for HIV. Once you identify your potential partnering agencies, approach them and make sure their staff know that if they need help, especially referring clients to them, your staff will be willing to help out. This collaboration is usually formalized when you develop a memorandum of understanding or a memorandum of agreement. The development of a strong referral relationship with community partners is an important part of ARTAS. It fosters a supportive environment between partners and reduces barriers to clients' linkage to care. So when you develop your MOA or your Memorandum of Agreement, it is important to be clear and honest about the benefits all parties, that is, the clients, the implementing agency, and the partnering agency will receive from the collaboration. With all MOUs or MOAs, it is important that if you are asking for referrals, that your agency can offer the potential collaborators something in exchange. Also, it is important to revisit them on a regular basis to make sure that the contact is still the same person and that the agency still wants to continue the referral agreement. In addition, make sure you have a social marketing and social media strategy in place to be able to use technology appropriately and effectively. That is promoting community partner services, being visible on the online community, etc. And make sure you collaborate with others and with other non-traditional yet strategic partners such as colleges and university campuses.
As Armand just explained, creating these external relationships is really important. But while this relationship building must be in place prior to the implementation phase of ARTAS, it is essential that the linkage coordinator maintain contact with them for the duration of the intervention. The linkage coordinator's work with community partners is not finished once a community partner is identified and that relationship is established. Keeping in contact with these sites serves as a reminder of the intervention, encourages referrals, and contributes to the successful implementation of ARTAS. The project manager may want to monitor the referral process, at least in the beginning of the implementation phase, to ensure that all agencies are complying with the protocol, assist with any challenges that arise, and identify solutions where needed. To maintain effective working relationships with community partners, the linkage coordinator should engage in regular face-to-face, telephone, or email contact with them. The linkage coordinator should also plan to participate in regular meetings with other HIV providers and groups such as community-wide referral networks, community planning groups, regional advisory groups, and case manager meetings, and to use these opportunities to continually market ARTAS to new community partners and medical care providers.
Staff turnover at partner agencies may affect the intervention's impact. The linkage coordinator should plan to educate and build an effective working relationship with newly hired staff. To minimize the disruption that can result from staff turnover, the linkage coordinator and implementing agency should maintain ongoing, frequent nurturing of relationships with key staff at all levels of the partner agencies. The linkage coordinator may find it helpful to make monthly calls or visits to community partners, especially the referral sites, to refresh their memories about the agreed-upon referral process and to keep the intervention in the forefront of all their minds as they encounter clients recently diagnosed with HIV. Some of the ARTAS demonstration sites found it to be helpful to require the linkage coordinator to contact referral sites at specific intervals, such as once a month. Regular contact between the linkage coordinator and community partners can result in trusting relationships among community partners and the linkage coordinator, increased visibility of the intervention, regular reminders about ARTAS, opportunities to answer questions that arise about the intervention or referral process, opportunities to provide or obtain updates on linked clients and show ARTAS is providing the services as advertised, finding clients who missed an appointment with the linkage coordinator, if the client allows the locator information to be shared with the ARTAS implementing agency, and lastly, close the monitoring of the ARTAS marketing materials.
Intra-agency collaborations.
So let's focus on within your agency. What types of collaboration and partnerships will help support your implementation of ARTAS? All departments that conduct HIV testing should know about ARTAS and the route to contact the in-house ARTAS provider. Inform all departments about ARTAS, either via an email blast or agency-wide face-to-face meeting. Make sure an email is short but covers that important points of ARTAS, including contact information, phone numbers, and names. Develop a short in-service on ARTAS that can be used in a staff meeting. Make sure that it is no longer than 10 to 15 minutes, but again covers the basics. Always provide updated names, numbers, and contact information for the ARTAS providers. There is sometimes high turnover in this field, so it's important to keep staff informed of their current ARTAS contact.
When it comes to the integration of ARTAS in your agency, let us just say that intra-agency support for ARTAS is key to the success of the intervention. All agency staff working on complementary or parallel interventions need to understand and support ARTAS at its most basic level, which is increasing linkage to medical care. Intra-agency communications, if done correctly, can minimize the perception that ARTAS staff are getting special treatment or they're stealing clients from other programs. Moreover, staff members who understand the value of ARTAS will be more inclined to work collaboratively with intervention staff and market ARTAS within their networks. For example, if you have a navigation program, think about how these programs can work side by side to support the overall goal of both programs. The reality is that some clients may be more appropriate or more ready for one program over the other. As a manager or supervisor, make sure the staff members understand how clients can best be supported. This is critical to the overall agency success. This is critical to your overall agency success. You can also consider some integration opportunities like recruit clients using the social network strategy, SNS, implementing motivation interviewing in the ARTAS intervention, or using ARTAS in jail or prison, and engage HIV-positive clients from jail and prison into care. One method to communicate the goal, benefits, and approach of ARTAS is to hold sessions specifically designed to inform non-ARTAS staff about it, and along with any ARTAS-specific information you share, also provide local data about linkage rates and agency-specific data for them. It helps staff understand the importance of devoting agency resources to the intervention. Now let's look at the other high-impact prevention activities you may be implementing. As a quick review, evidence-based behavioral interventions, or EBIs, that have been scientifically proven to significantly reduce HIV risk. Public health strategies are time-tested protocols used by public health practitioners in the prevention, screening, diagnostic, or treatment processes for HIV and AIDS prevention. ARTAS is a public health strategy, not an evidence-based intervention. Biomedical interventions use medical, clinical, and public health approaches designed to moderate biological and physiological factors to prevent HIV infection, to reduce susceptibility to HIV and or decrease HIV infectiousness. Medication adherence strategies are an important category of biomedical interventions, and these effective interventions can be found on their website, effectiveinterventions.cdc.gov. This website has very helpful information on all of these interventions.
Your HIV testing component will be the most reliable source for referrals to ARTAS. Testing Together is a perfect example of a public health strategy that was initially developed to test couples or throuples in more than three people together. It's a natural course that if the person tests positive for HIV and are reluctant to link to care, ARTAS would be perfect would be a perfect active referral. If the intervention's target audience is people who are high risk for HIV-negative persons, linkage to an ARTAS counselor would not be the right referral. Now, most of the behavioral interventions and public health strategies will support a referral to an ARTAS counselor. Let's look at it in more detail. If you're implementing a high-impact prevention public health strategy currently supported by CDC, you can think about integrating ARTAS in a few ways. One, if your public health strategy identifies HIV-positive clients that have not yet linked to care, they should be referred to ARTAS. Two, ARTAS clients may need to be linked to partner services. Three, ARTAS clients may be appropriate to become social network strategy recruiters. Four, ARTAS clients may bring their partners in for testing. Interventions such as data to care, SNS, social network strategy, HIV partner services, testing together, and testing together.
Integrating ARTAS into EBIs.
So Melanie just talked about the public health strategies that work well with ARTAS. Now we're going to think about some of the EBIs that work well with ARTAS. So if you're implementing any high-impact prevention behavioral interventions currently supported by CDC that are appropriate for implementation with HIV-positive persons, you can think about integrating ARTAS in three main ways. First of all, if one of your EBI clients have not yet linked to care, they should definitely be referred to ARTAS. Second, ARTAS clients who link to care may be referred to EBI programs to continue to get support to remain in care. And finally, ARTAS clients who are not ready to link to care may be referred to EBI programs to help address their barriers to linkage. Some of the common EBIs that we're working with HIV-positive persons are listed here on the screen for you, including Promise, DUP, Empowerment, POL or Popular Opinion Leader, CLEAR, Willow, Healthy Relationships, Connect, Partnership for Health, and Start Plus.
If you're implementing any high-impact prevention biomedical interventions for medication adherence currently supported by CDC, you can think about integrating ARTAS in two ways. One, ARTAS clients who link to care may be referred to biomedical programs to continue to get support to remain in care. Two, ARTAS clients who are not ready to link to care or may learn about your biomedical interventions from linkage coordinators, intervention staff, or peers to help overcome their fears or barriers to linkage. The adherence strategies listed below show efficacy in improving either medication adherence and or viral load among ART naive and ART experienced patients. Number one, the every dose every day is designed to help providers support medication adherence among people living with HIV to improve health outcomes and reduce the risk of HIV infection. HEART, helping enhance adherence to antiretroviral therapy, is an individual didactic social support problem-solving intervention delivered before and in the first 2 months after initiating ART and includes a patient-identified support partner. 3, Partnership for Health for Medication Adherence is an individual-level, clinic-based, brief provider-administered intervention emphasizing on the importance of the patient-provider relationship to promote adherence. 4, Support is an individual and group-level intervention where HIV-positive individuals currently adherent to ART serve as peers and provide medication-related support, social support. SMART, sharing medical adherence responsibilities together. Couples is a discordant couple-level intervention which addresses ART adherence and safer sex practices within the dyad by fostering active support between partners.
Please let us know that if you need to seek capacity building assistance for any questions or doubts that you may have with any of the interventions, and we will be more than happy to address them. And this slide gives you more information on capacity building assistance and how it works and how to access it. And this slide will give you information on how to access any of our services or any questions that you have. And to help you gain more knowledge on staffing and supervision, we invite you to participate on the third module in this series. There we will provide more information on staffing and supervision. If you would like to access the third module, now click on the link provided below in the second box entitled Links. To receive CEUs, please click on the CEU document in the pod and answer the 2 questions. Thank you so much for listening to this webinar, and we really look forward to hearing you in person on the live session.